I'm Dr. Ian Clary, and I'm joined with Dr. Brad Littlejohn, and we're having a discussion over the current crisis that's going on in terms of the COVID lockdowns, churches and Christians' responses to governments that are restricting worship. And we're going to turn now, as if we're not already having a controversial enough subject, we're going to turn to something even more controversial, and that's the actual virus itself. And I want to ask you this question. How serious is the virus really?
Yeah, well, I mean, obviously, this is not my expertise as such to answer that question, and it's to some extent this should be a moot question because of what I said before about civil government is established to solve a knowledge problem. The question how the problem of how do you know what the biggest dangers are? How do you know what responses should be taken? And it's an attempt to vest the authority to answer those questions in those who have access to the most information. And our job as citizens is generally to trust. And of course, as we said, part of the problem is some of that trust has been compromised, some of that trust has been forfeited. But I think, for instance, in our initial lockdowns this spring, I think the appropriate posture really, quite clearly, would have been to say, well, this is a new virus. There's a lot of unknowns. We don't know what's going on. It doesn't seem that bad yet. I mean, I don't know anyone who has it, but they're telling us it's really bad, saying all over the world it's really bad. We will assume that the government knows what it's talking about and we will act accordingly. I do think as time passes, there's more of a burden of proof on our leaders to demonstrate that there's sufficient cause for extraordinary measures, right? I mean, the relationship of citizens and leaders is not like children and parents. Certainly not like, it's more like maybe, teenage children and parents rather than young children and parents. You can't just say, because I told you so. You have to be able to give some, you do say that perhaps for younger children, but as time goes on, you have to explain why did I tell you so. So I think it's absolutely legitimate for us to look for clear explanations from our governing authorities about does this require the kinds of actions that are being demanded. And I do think, thankfully, as time has passed, there's a lot more clarity about the virus. The fog of war that surrounded it in the early days is largely cleared. And I think we know, as far as I can tell, we really know most of what we need to know at this stage in order to act prudently. We know that the virus is not crazy deadly, but it is much deadlier than anything that's been, widespread in a long time. It's probably in the early days of the virus, as best we can tell, it was, killed about 0.8% of people infected. Now, as treatments have improved, maybe 0.4%, which doesn't sound like much, but you assume a population that has no immunity, and you've got, even 0.4% in the entire U.S. population could be close to 1 million deaths. That more importantly, or maybe not more importantly, but just as importantly, the issue that's been highlighted from early on is, and this is where the virus poses a problem for us, that it perhaps earlier generations were fortunate in as much as they were more powerless in the face of things of this sort, right? People sometimes say things like, well, back in the 19th century, people didn't completely change their lives because of, plagues, which isn't entirely true. In fact, you read accounts of plagues and people did, flee to the countryside, and it could upend society in big ways, but probably not over something that would have killed less than 1%. The difference is we have the power of, we can manage that percentage. We can keep a lot more people alive, potentially, or a lot more people can die because we have a capacity for medical care that they didn't have in previous generations. So because we are able to treat people and able to save lives, we have a responsibility to treat people and a responsibility to save lives. And those that we have put, I think particularly those who dedicate their lives to the task of healing and caring for people, our doctors and nurses, we have responsibility to them as a society not to make their lives a living hell if we can help it. So the biggest issue has been, if the virus just runs straight through the population, then because of the way exponential growth works, way too many people are going to be sick at the same time. Healthcare systems can't cope. Doctors and nurses are going to be overwhelmed. They're going to get sick themselves. You have nervous breakdowns. Quality of care is going to decline. A lot more people are going to die than need to die. And so from early on, the focus has been, how can we manage the virus in such a way as to prevent that exponential growth from getting out of control? And the problem is, the way exponential growth works, really, you either have to, people talk about, the original metaphor is flattening the curve, right? Yeah. Now, to have an absolutely flat curve means you get the virus transmission down to 1.0, right? Which means each infected person infects one other person. And then it just looks like this. The number of new cases is constant. Now, that's a very, very delicate balancing act, and hard to maintain. So really, it's more like you get it below 1.0, so the number of cases goes down a fair bit. And then you can afford to loosen up enough so it goes to maybe 1.3. And 1.3, within a few weeks, can multiply a lot. So then you're in a dangerous place. Then you have to tighten up a lot more and get back down to 0.7 or and so on and so forth. And that's where all these different things like wearing masks and such come in, is wearing masks alone will not get rid of the virus, but it will get it down to where more modest measures maybe are other, a few other restrictions might be enough to get it down below 1.0. And, and I think that's where people have talked about, why can't we just seek herd immunity? Why can't we just shield the vulnerable? Again, we could, before we had a viable vaccine, I think there was a good argument for, we don't even know if we're going to be able to solve this. Maybe we should just try to get to herd immunity as quickly and safely as possible. I think now that we have viable vaccines, the responsible thing to do is to try to keep it under control as much as possible until people are vaccinated. But the other point was just, even if you were pursuing herd immunity, that couldn't mean unrestricted exponential growth, right? If you're allowing it, if it's growing at 50% per week, then within a few weeks, it's gonna be growing at 500% of what it was, and 5,000%, right? And that's where the healthcare system's overwhelmed. So even a herd immunity strategy requires a lot of controls.
Yeah.
And people talk about shielding the vulnerable. Well, they often don't think about how many people are vulnerable, how many people are over 65 in the US, how many people have heart conditions, or have obesity, et cetera. And how exactly do you keep them from being in contact with anybody? I mean, the most vulnerable people are the people who need caregivers, right? So you have to shield the caregivers too. And so, what it comes down to is, I think, and we've seen this, I think part of the reason people get themselves into these conspiracy theories of, it's not really that big a deal, is from a very narrow view, and often their own country, or more often their own state or their own region, and just thinking in terms of, well, I don't really know anybody who's had it that bad. And if you look at this on an international level, it's clear governments around the world have had to take extreme measures and had to do so repeatedly. I mean, England is now in its third lockdown after trying each time they said, we really don't want to do a lockdown, and they had to do it a third time, right? So it's not a manufactured crisis. It's a real crisis. In itself, that leaves all kinds of policy questions unanswered as to the most appropriate restrictions, how you balance the fact that this is a very long time frame that you're asking people to operate under restrictions. And, there are different, very good arguments to be had, very important arguments over what kinds of policy approaches should we have. But I think what we do need to do is we need to recognize that it is a really genuinely serious crisis that requires a kind of coordinated action in a way that we're just not accustomed to. And our temptation always, when presented with a new problem that's really demanding and really perplexing, is to just want to deny that the problem exists. If it's an inconvenient truth, then we reject it. And I think what's been troubling to me is seeing how many Christians, they start off asking making legitimate objections, asking legitimate questions, saying, should churches maybe churches should be higher on the priority list than schools or something like that. But then they start talking for a few minutes, and pretty soon they let on that really they don't believe the virus is that big a deal anyway, and they start repeating various debunked talking points about this. And I think if Christians are going to be taken seriously in the public square in fighting for the rights of the church in this kind of situation, we need to show ourselves willing to really grapple with inconvenient truths and not just try to minimize or deny a problem because we don't like the sacrifices that it imposes on us.
You have people who ask questions in good faith, that they're genuinely trying to sort these things out and try to steer a right course through it. And then others who are just hostile to the government and they're immediately dismissive of the virus because the government is involved in it. And it seems to me that's not a wise course of action. Like, as Christians, we're called to walk respectfully, to be wise, to be prudent. Why is it, do you think, that there's just wisdom just seems to be tossed out the window on this?
Yeah, I mean, that's a big question. There's the roots of the problem go back, I think, quite a ways. I mean, I think, as you noted, in America in particular, there's a sort of a tendency to default to a certain adversarial posture toward the government, but it's not just government. In general, the last few years, there's been a reaction against a distrust of experts generally, and blame for that is probably goes equally in both directions. I mean, the problem is to non-experts, to ordinary people, sort of all experts, all academics are kind of thrown into the same pot, which is unfair because, there are people out there who get PhDs in gender studies or whatever and write ridiculous things about, the penis as a social construct or something. And there are people out there who study diseases under, electron microscopes and come up with vaccines. And those are very different types of intellectual inquiry that deserve our respect in different ways. But the fact that there have been so many so-called experts developing forms of spurious expertise and using it to sort of assault social norms, I think has discredited all experts in the eyes of some people. I think that's part of the problem. And of course, part of the problem is, we mentioned earlier, that just proliferation of different sources of knowledge, different claims to authority. We're not wired as human beings to sort through such a massive deluge of different contradictory claims on every conceivable subject, which is what we have now. We have access to, you think of just most people historically grew up in communities where most things were taken for granted, and there were things that they argued about and so on. And they knew that there were some people in the other, next village over who might do things differently. But disagreement was sort of circumscribed within manageable boundaries. And those boundaries have been blown open in the modern world, and especially since the advent of the internet. And so people's defense mechanism, right? People are just overloaded. And the defense mechanism is to build a mental shell, put a few of your friends, build an ironclad structure, huddle a few of your friends in it, and, huddle together for safety, and repeat convenient truths to each other and ignore the inconvenient truths. And one of the most important things the church can do today is equip people for really with intellectual virtues, equip people with the courage to exercise wisdom in uncertain times.
Hence the work of the Davenant Institute.
Indeed.
Well, having now thought a little bit about the virus, we'll turn in our next segment and look at again some of these questions pertaining to how should churches be treated, and whether the government can actually put barriers on things that lead to churches.
All right.